Hello and welcome to Legacy Healthcare's 20-minute tune-in for April 2017. Today we are talking about the topic of spaced retrieval, and with me I have Erin Gehring. She is an occupational therapist and dementia management clinical program lead for Legacy at Morningside of College Park. Morningside of College Park is located on the north side of Indianapolis. And Erin has been using the spaced retrieval technique for a little while and wants to share her successes and trials and provide you with an example of how she's integrated it into her practice. So Erin, thank you so much for being here today and welcome.
Thank you. Thanks for having me. Well, we'll just go over the objectives for this 20-minute tune-in. You will learn how to identify the uses of spaced retrieval, identify spaced retrieval screening method, and we will list the development steps of spaced retrieval. So just to share with you some background on this spaced retrieval, I received an email a few months ago from Alyssa, and she had sent out a YouTube video on spaced retrieval, and it was just a 4-minute clip, but it taught me very quickly how to use this method to help someone remember some information that would be important for their life. And it referred to this book at the end of the video, and so I ended up getting the book to help me along with this, but using even the 4-minute video would be helpful as well. I did just start implementing it right after. But according to this book, spaced retrieval the theory is based on the classical conditioning theory, which is from psychology classes, if you remember Pavlov's dog. So Pavlov's dog, as the scientists would enter the room and feed them, they noticed that after a few times, the dog would start salivating at just the sight of the scientist. So that's the idea behind spaced retrieval. You have this information that you're transferring from the present to the long-term memory. So that way someone with memory problems can learn to use their memory. So with people with Alzheimer's, they lose their declarative memory, which is the conscious memory, and we have to transfer to the non-declarative memory, which is the unconscious memory, and that's where spaced retrieval taps into. Just like the Pavlov's dog. That's where motor memory goes into. And an example the book used is when you're driving in a car and you've gone 5 minutes and you kind of think, oh, I'm here already. I don't even remember getting here the last few minutes. That you were using your non-declarative memory to drive your car and arrive someplace. So that's the kind of memory that spaced retrieval uses. The outcomes with spaced retrieval are really good because they use errorless learning, and I'll teach you more about errorless learning later. But studies show that spaced retrieval is that the outcomes are better because of this use of errorless learning. And if you're wondering, spaced retrieval is well researched. Some uses of spaced retrieval. It can be done with anyone with memory problems. I used a lot on our memory care unit. So an ACL score of usually somewhere between 4.6 and 4.2. I haven't tried it with a high 3 yet, but I did try with a low 3, and I did not have success with a 3.2 recently. But not to say that you couldn't try. There's a screening process, and if they can, pass the screening process, then go for it. They might benefit from it. This can be used for safety things like calling 911 or using their emergency alert button, using safe walker routines or swallow strategies. It can be used for ADL routines. You can use it for remembering to use a schedule or a calendar, or how to use your cell phone, taking medications on time, completing chore tasks, or even steps to laundry tasks. It can be used for wayfinding. Some examples of wayfinding things that have been used before are finding the room number, remembering your phone number or address, locating the dining room or locating activities. I use it that way a lot around my facility. And then maybe even locating a place to find information. I haven't done this yet. I have to get permission from our facility, but I would love to put like an information sign on our memory unit and then use spaced retrieval to teach people how just to go and look at it, because, in the afternoon when everyone's sundowning, they don't remember, they want to go home and they wonder, or everyone's in their home. It's one of the two. Either they want to get out or they want everyone to leave. So I thought it would be great to have a little information station to go to and say, here you are on a map, and kind of like at a rest area, here you are.
Sure.
And then explain that you're at this facility and you live there and meals are provided there and that kind of thing.
Erin, one of the questions that popped into my head just now is many of our residents and clients are going to have difficulty with more than one of these areas. So if you find that they're receptive and the spaced retrieval technique works, can you use it for multiple things? For example, could you use it for walker safety and wayfinding, or should it really just be concentrated in one area?
You can use it for multiple things, just not at the same time.
Okay.
It gets very confusing. Early on, I did try to do that, and it was a recipe for disaster.
Okay, and that makes sense. So really, as the therapist, you would really want to identify the biggest problem area for your particular resident.
Yes.
Okay.
I did end up reading the book on spaced retrieval. And I forgot to say the author, but it is Spaced Retrieval Step by Step it was on the screen back ways, Jeanette Benengas. So they gave an example for that question that if someone needs to call 911, you can't just start to teach them 911 if they can't figure out how to use their cell phone. So you have to back up, you start by turning your cell phone on.
Okay.
Then once they master that, then you work on charging the cell phone, because it has to be, charged. So yeah,
some definite task analysis there.
Yes.
Okay. Good.
So you want to start with your screening process to determine if they're appropriate for spaced retrieval. So to do that, you start with your intervals of you find out what they need to learn. Oh wait, I'm sorry. The screen is just you get a novel information. I often use my name. I've already got my name on my tag, and if I sit in front of them, then the visual cues in their direct line of sight. And the idea is that if they can retain the information after 30 seconds, but it doesn't have to be 30 seconds on the first try. You start by using the timed interval of 5 seconds, and then 10 seconds, and then 20, and then 30. So I often will say, like, Sarah, can you, or my name is Erin. I want to see if you can remember my name. What's my name?
Erin.
Good, that's good. And then you wait 5 seconds, and then you say, Sarah, what's my name?
Erin.
Good. You wait 20 and then 30. And if they can remember it after a 30-second delay, then they're appropriate for it. But if they miss it on the first day, they're not ruled out. They still, because people with dementia have good days and bad days, they may do great the next day. So they're ruled out only if they for 30 seconds after 3 attempts, given the 5, 10, 20, and 30-second delay.
Now, can they use that visual cue of your name tag to help them, or do they have to remember your name without that visual cue?
They can absolutely use the visual cue, and you should point it out to them at first, and because that's the point of the errorless learning for spaced retrieval. You're giving them the answer, and they can look right at it as you tell them your name, and you can point to it, and then so then you can keep pointing to it if they miss. So if they miss in that 30 seconds, you back up and you try 20 seconds again. Say they missed at 20 seconds, you back up and you try 10 seconds. And so after, like, maybe you work on this 20 minutes, if they remember after 30 seconds and 20 minutes, then they're appropriate for it.
Okay.
And then during those wait times, when you got 20 seconds to wait to ask them what my name is again, you might want to check to see if they can read. Could they read your name tag? If they couldn't, if you made it bigger, could they read it then?
Okay. So then the next steps would be, once you identify somebody is appropriate for the technique, then there's kind of a step-by-step process. Can you talk about that a little bit?
Yes, you need to get to know your client before you determine what it is that they need to learn. So through your evaluation, you might see that maybe they forget to lock their wheelchair brakes. So then if you identify that, or if you're referred for having a fall or problems with transfers, you might identify that as your need. Well, first they need to learn to lock their brakes. So if that's their biggest problem, that's your need. And from that need, then you develop your question. So you're trying to get to the answer of locking the brakes. So the question could be, what do you need to do before standing from the wheelchair? And then now you have your response, which is locking the brakes, and that's what the resident responds. In the response, you always want to keep that very simple, try to limit the amount of words, and then you always want to pair it with a visual aid if possible, and place that visual aid within their line of sight continuously. And that's where you get the errorless learning. So if they can see that, you might still have to point it out to them, even though it's in the direct line of sight, but that will help minimize frustration. So when you begin spaced retrieval, you want to explain to them very clearly about what you're going to teach them and why. And then you introduce the lead question and you allow for their response. You provide that visual cue in the line of sight. And then you begin by asking your lead question, them responding, and then you immediately follow with a task. So if it is locking the brakes, then right after they respond, lock the brakes, right after they read that visual cue, then you say, please do that now, and have them do that visual cue. And then that allows for their motor learning as well. And it's very essential to pair that motor learning with the verbal and the visual, and that's how they can transfer it so much better to their long-term memory. After that, then you progress by these intervals of 5 seconds, 10 seconds, 20 seconds, 30 seconds, and then 1 minute, 2 minutes, 4 minutes, 8 minutes, and 16 minutes. So if they are able to get to where they can retain that information to 16 minutes, then that's where you would end your session.
Okay.
So you would need like at least 30 to 60 minutes to end the session. If they provide a wrong answer anytime in that sequence, from 5 seconds to 16 minutes, you would back up and try the earlier interval time and then continue on from there.
Okay, can you give an example of that?
Okay, so with locking the brakes, so you would ask them, say you're at 30 seconds, you waited 30 seconds to ask the lead question again, and then you provide that lead question again. What do you do before standing up from the wheelchair? And then you allow for the answer, lock your brakes. If they don't answer that, then maybe they answer, I just stand up. Then you don't point out that they're wrong. You point to the visual cue and you say, you lock your brakes. And then do that now, and then have them lock the brakes, and then you back up to the interval before. So if we were at 30 seconds, we would back up to 20 seconds.
Okay. So it's really all about giving them the opportunity to be successful before moving on to that increased time.
Yes. You may take several seconds to get past a 30-second interval. Okay. or to get past that 30-second interval with someone who's 4.2 and in a distracting environment. So you might want to move to a low distracting environment for these first few times, because it's really hard for them to get when they're in that busy environment.
Okay. All right. That makes sense.
And then it's essentially transfers to long-term memory once they have remembered that response at the beginning of the session. So when you give that, the first time you give them a response, that lead question, and they remember it right away without having worked on it for however many days, then it is, if you have 3 consecutive sessions like that, then they have transferred it to long-term memory.
Okay. So it doesn't matter, like when you're treating a patient, is it best to see them 5 times a week so that you're getting that repetition in, or does it just depend on the individual person?
I think that it probably, if they're pretty severe, it probably would be like a 4.2 or a 4.4. It would be best to do 5 times a week, because they'll be more successful, and then they won't get as frustrated as with it, and it'll have better carryover. But I will have to say I did have success with a 4.2 at 3 times a week as well, but it was it took longer.
And then one other question, is there ever a point where you would end the session prior to accomplishing that 16 minutes of space?
Oh, that's a great question. Yes. If they are, if they have 3 consecutive errors, then you would, and you have already taken the interval back, then you stop. Like if they have 3 errors in a row, if say they got to 8 minutes and you dropped back to 4 and they had another error, and you dropped back to 2 minutes and they had another error, then you just stop and you start next time. Okay.
And one more question before we move on, but have you had clients that have become extremely frustrated with this technique? Like, I can see some folks in that mid to high 4 range becoming frustrated, or does the fact that we're trying to get them, to that errorless point kind of make up or prohibit the frustration from coming out as frequently?
Now, I did have people that got frustrated when I was doing it wrong. So I ended up reading that book to see, where am I going wrong? Because I was giving up on spaced retrieval. But after I read about it, then I realized it was on my error. At that time I tried to do a couple different ones, and I wasn't giving a good visual cue. Sometimes the lead phrase isn't working for them, and you need to find a different way to phrase that, something that works better for them.
Okay.
But then you do have the people that are like, this is silly. I don't see why I have to do that. And that's the high 4s,
Sure.
So with that, I think starting back over that beginning phrase, how you explained why you're working on it, re-explaining that several times, throughout your session might work for that, to help kind of calm that down. But more than anything, sometimes where I expect someone to give me a hard time about it, they don't. And I often, like the lady that I was teaching to lock the brakes, she had a fall from her wheelchair. And it was funny because every time she forgot and I told her, showed her the visual cue and that kind of thing, she was like, oh, thank you so much for showing me that. I was really excited about knowing that, because that would be important so she doesn't fall. Like, she understood that part. But
Good. Well, let's demonstrate.
Okay, so I have an example here. And this is an example that a speech therapist could do, or an OT. This is an example on training a swallow strategy. So we're going to say that Sarah has trouble eating too fast, and that's the problem. We identified this problem with Sarah. She's eating too fast, and we need to teach her how to eat slowly so she's safe. So we've already determined the lead phrase, or the lead question and the response. So provide that response in the direct line of sight, and then you begin by giving your explanation. So here's our example. Sarah and I are going to role play. Sarah, I would like you to enjoy your food safely. When you eat, it is important that you eat slowly. Here's a reminder for you. And then you place the note card above her plate that says, eat slowly. Would you please show me how you eat slowly? That's correct. You will be safe if you eat slowly. What should you do when you eat?
Eat slowly.
Good. Then you begin your time interval and you wait 5 seconds, and then you provide your lead question again. What should you do when you eat?
Eat slowly.
Perfect. Show me how you eat slowly. This continues for the intervals of 10 seconds, 20 seconds, 30 seconds, 1 minute. And let's say after 1 minute, we're going to pick up there. Sarah, what should you do when you eat?
I just eat. I don't think about it.
Okay, so she provided the wrong response. I just point to the visual aid and say,
slowly.
It's important for you to eat slowly in order to safely swallow your food. Show me how you eat slowly. And now we reduce the interval time back to 30 seconds and then begin again with the lead question.
So, Erin, when there's that space of time, whether it's 30 seconds or a minute, are you doing anything or having a conversation with the person, or is it just kind of quiet so that it's not distracting from what they're trying to learn?
Well, you do stuff. You can't do much between 5 and 10 seconds.
Sure.
But, keep your timer, because that's key. Keep it right with you when you're doing the spaced retrieval. But you need to I'm sorry, the screen changed. What was your question?
Sorry, I didn't mean to distract you. What to do with that kind of empty time in between the intervals? Yeah.
Okay, thank you. So you can have conversation, you can play cards, you can do ADLs, that kind of thing, but you want to be careful, and that's kind of where I got into trouble at the first. Being an OT, it drove me crazy to sit for 10 seconds and not be doing something like an ADL. So I would start doing ADLs with the person, but then it was really hard to just stop in the middle and ask the lead question because it didn't seem appropriate in the middle of an ADL. So
good point.
In the beginning, when you're less than 2 minutes, if your interval is less than 2 minutes, don't get into anything too big. Stick with just a simple conversation or point out how you like their clothing and that kind of thing until you have more time. Now, when you get to 30-second interval, you could probably do like an arm exercise or something in between, and that'd be perfect.
Okay. All right.
Let's see. So I'll go ahead and move on to some problems with success. So I've kind of touched on some of them, but these are all things that I had trouble with doing. So I ended up reading the book to figure out what was going wrong with my session. So I can probably save you some of the time in reading the book and give you some ideas. So if you notice your people are not progressing and you're stuck on certain intervals, try not to get frustrated. One of the big things is we need caregivers to get involved. You can't do this alone. It's a team effort. It's got to be carried over. You can transfer something to long-term memory, but if you don't keep it up and no one ever provides that lead question again, then they won't remember it. So you need to get their caregivers to repeat that lead question several times a day, or after they've been using it a while, maybe just once a week or once a month or so. But in the example that we did earlier about the lady who needed to learn to eat slowly, what you could do is just put that note card that says eat slowly in front of her plate with her meal every time, and that might be enough just to keep her remembering that with each meal. There is a if if your building tends to do like quarterly screens, that might be a nice thing to add into your quarterly screens.
Oh,
that
good idea.
Asking if they, providing that lead question, and if they have no idea what you're talking about, then that would be an indication for maybe to get back into therapy. And after they have already transferred something to long-term memory, it is easier for someone to learn that information again. So you might see that with, someone with a walker, people that were doing good with a walker, and you spend some time refreshing that, they'll start doing better again if they already knew how to use it.
Okay.
If the person is struggling to advance a specific time, like if they get stuck on 1 minute or 2 minutes, you don't have to stick with that 2, 4, 8, that doubling. You can like change it to whatever is appropriate for them, like 2, 5, 7 minutes rather than the other. So, or if they're a really quick learner, like you were saying before, if they are a high 4 and they're picking up on it so easy, then you could advance it quickly to like 5, 10, 1 minute, and then 2 minutes, and then 6, 10, 16. So you can gauge that towards each individual. Another problem with success that I touched on earlier is trying to do too much in the minutes that between your intervals. So just remember that to keep your work on spaced retrieval focused on spaced retrieval, and not try to do, all these different things in one session. And, that's, if it's a really big, if your indication was falls and you have to learn to lock the brakes, that's really like to work on that before balance, the focus of the session. Just work on that and get to the point where you can go for 4 minutes and then work on balance with 4 minutes. But that is a big thing. You need to focus on one issue for that amount of time before you move on to anything else.
And really communicating that with your therapy coworkers so that they can repeat. And maybe you as an OT or a speech pathologist starts with that spaced retrieval, and then it's followed up with the PT who is getting that person in and out of the wheelchair, and they can then use that same technique and words, making sure that the words are consistent. I would imagine is going to be really helpful.
Yes, Sarah, that's exactly right. You have to, and you can give that that visual cue.
Mm-hmm.
If you can have the PT work on the same thing and use the visual cue. There was a lady that I'm working with right now. We just changed her from a cane to a walker. She's familiar with the cane, but I just hung the little sign that says the walker, and that was her response. And what do you do before you go walking? Or what do you use every time you take a walk? And the response is the walker. And if you during my session, I kept it on the walker in front of her the whole time. But yes, I could give that note to the PT and they could continue that every time and provide that phrase.
Excellent. Well, I think this is a lot of good information, and I think it's something definitely that will contribute to the success of our dementia management program. So I want to thank you, Erin, for using it, trialing it, sharing not only your success but your frustration with it, because I think that's what really happens out in the field. So thank you for taking the time to present your information. And actually, Erin will be with us next month as well. She is going to provide us with what I'm calling a tale of two apps. She's looking at 2 different posture apps, and is going to explain the differences between those and how you can use those in your clinical practice. So look for that coming out in May. Erin, thanks again for your time, and we look forward to hearing anything else that you'd like to share with us on your successes with spaced retrieval.
Thank you.